Welcome. For anybody I haven't met, I'm John Hopper, the president of the foundation. And this is part of a series that we've been doing for a while now to really empower our patient and caregivers on their journey. We are recording just Monica's presentation, and for privacy, we'll turn that off. So please participate. This is informal. It's meant to be a discussion. It's a dialogue versus a monologue. So without further ado, introduce Monica Bryant. She's a cancer rights attorney, and she's the co-founder and chief operating officer for Triage Cancer. It's a nonprofit that provides quality information on insurance and financial and legal issues surrounding serious medical conditions like cancer. Monica has provided over 1,000 educational seminars, written articles, co-book published by the American Bar Association called Cancer Rights Law, an interdisciplinary approach, as well as appeared on television and radio discussing healthcare-related legal issues. Monica has a great legal career from the Hill. She's also an adjunct law professor and teaching a class on cancer rights. And with that, Monica, I give it to you. Thanks so much for being here.
Well, thank you so much for that lovely introduction. I'm delighted to be here and to be partnering with a new group. We really at Triage Cancer believe very strongly in collaboration, and so I'm really quite delighted to be here. So I know we have a small group today, but in the interest of making sure we at least touch on some of the most common issues that come up around health insurance, work, and finances, I am going to give a presentation. But please feel free to type questions as they come to mind in the chat box, and we'll certainly get to them. And then at the end of the presentation, we can take questions live as well. So when we talk about cancer, there is a term that has become quite popular over the last couple of years called financial toxicity. And really, this term was coined by researchers at Duke University in 2013. And what they looked at in their research was how the financial burden of a cancer diagnosis can be as significant, if not more so, than the physical burden cancer and cancer treatment can cause. But what was particularly interesting about their research was they didn't just look at the dollars and cents of all of it, but they looked at the impact on quality of life and survivorship. So when we talk about financial toxicity, we really think that it has to be a bigger discussion than just cost of care or financial assistance. And so we have lots of tools at Triage Cancer to help you address these issues. And you're going to see throughout the presentation many links back to our website. And at the end of the presentation, I'll tell you a little bit more about the organization and the specific services, so that if after today you don't get an answer to what you're looking for, or a question comes up later, you know where to go to get that information. So financial toxicity, relatively new term, certainly not a new problem. So why is it so challenging to address financial toxicity? Well, we believe it's because there are multiple contributing factors. And the number one most significant contributing factor is health insurance status. Now, that could mean someone doesn't have health insurance at all, but more often what it means is that they don't have the right health insurance policy for them, or it's not adequate for their needs. But it's also about being able to effectively navigate health insurance, and that is an easier said than done situation. Certainly, the employment changes that can occur after a cancer diagnosis can impact finances. And this isn't just for the person who's been diagnosed, but it's also for the caregivers and the family unit as a whole, and those employment changes that occur. And then certainly life changes. So all of the things that normally impact somebody's finances continue to happen even after a cancer diagnosis. So relationship changes, or graduating from school, or moving, all of these things are going to just compound the problem. So why am I telling this? In order to effectively financially, or at least mitigate it, we have to address all, or at least most, of these factors. So I'm getting a notice that my internet connection is unstable. I'm going to assume y'all stop me if you can't hear me. The joys of pandemic presenting. So when we talk about health insurance, one of the challenges is that it's complicated. In fact, we have all sorts of data that tells us that very few Americans understand what health insurance actually does for them, how to navigate those policies, what the terms are. It's like learning a new language, but no one ever teaches it to us. And certainly, if you don't understand any of those things, how can you possibly be expected to pick the right health insurance policy for you? So I'm going to start at the very basics. There are 3 places where we as Americans get health insurance. The largest group gets their insurance through an employer. The next largest group gets their insurance through the government, primarily through Medicare and Medicaid. And then the smallest number of Americans actually go straight to a health insurance company to get their coverage. But regardless of where you fall on this triangle of coverage, there are terms that are going to be used that are the same, and they're incredibly important that you understand them. So these are terms specifically related to costs. So first is your monthly premium, and this is the amount that you're going to have to pay every single month, whether you use your care or not. So it's like having car insurance all year, but never getting into an accident and filing a claim. But then there are some additional costs that you have to pay once you start using your medical care. The first is your annual deductible. And this is a fixed dollar amount. It's going to depend on your policy. So someone might have a $500 deductible, someone might have a $5,000 deductible. But it's the amount that you have to pay out of pocket for your care before your health insurance company starts picking up their share of the costs. Their share of the costs is referred to as cost share or co-insurance. And this is a percentage. So if you have an 80-20 plan, it means that once you've paid your deductible, your insurance company is responsible for 80% of your medical costs and you're responsible for 20%. But many policies also have an additional payment called a copayment. And this again is a fixed dollar amount that will vary plan to plan and even service to service. So for example, you might have a plan with a $25 copayment to see a doctor, but a $35 copayment to see a specialist and a $250 copayment to go to the ER. But one of the most important things to understand about your policy is the out-of-pocket maximum. Now, this is again a fixed dollar amount that's going to vary plan to plan, but why it's so important to understand is because it is in a worst case scenario the most that you're going to pay out of pocket. Now, every plan will have their own formula for how to get to that out-of-pocket maximum, but many of them will add up everything you've paid towards your deductible, everything you pay towards your copayments, and everything you pay towards your coinsurance. So it's literally everything out of pocket except those monthly premiums. Now, the devil's in the details here. So typically they will only count payments towards in-network services. And they will typically, if they're not a marketplace plan, which we'll talk about in just a minute, they might have a different formula here. So for example, they might carve out copayments. So here's a simplistic example of how this all works. Meet Dan. Dan has a plan with a $2,000 deductible. It's an 80-20 coinsurance and an $8,000 out-of-pocket maximum. Dan hasn't seen the doctor all year, but then he gets into an accident and he has to spend a week in the hospital and ends up with a $102,000 hospital bill. So what does Dan have to pay? Well, the first thing we always have to pay is that deductible, which leaves $100,000 left of the bill. He has a coinsurance of 20%, so that's $20,000. But does he have to pay that full $20,000? The answer is no. He has to pay another $6,000 because he's already paid $2,000 towards his out-of-pocket maximum. So another $6,000 gets him to his out-of-pocket maximum, and then his insurance company picks up 100% of his medical costs from there. So I am not suggesting that $8,000 isn't a lot of money. Of course it is. But when we start to look at what the alternative is without the out-of-pocket maximum or without insurance at all, you can start to see how at least understanding that out-of-pocket maximum allows us to plan for a worst-case scenario. Now, if you would like to hear any of that again, or think that there's somebody in your life that might benefit from hearing those terms or this example, that's included in one of the animated videos that we have on the Triage Cancer website. It's about 5 minutes long. It's available in English and Spanish. And it's totally free to access. So I think it should be required viewing come every open enrollment period. So one of the issues that comes up quite frequently, both when an individual is diagnosed who has health insurance through an employer, but also when an individual is diagnosed who might need a parent or a spouse to act as a caregiver and might need to take time off for that reason or stop working for that reason. I told you that the largest group of Americans get their insurance from an employer. So what then? COBRA is the federal law that allows someone to keep the exact same insurance that they had when they were working. It's the exact same policy. So it is the same network of providers, the same payments, the same everything. In order to be eligible to elect COBRA, you have to work for an employer with 20 or more employees. Now, the benefit is it's the exact same policy, so nothing changes. The downside is that it's really expensive because now on COBRA, you're responsible for 100% of the premiums, plus sometimes a 2% administrative fee. So it can feel very cost prohibitive. Now, the length of time you're going to be able to keep COBRA is going to depend on your qualifying event. So if you're the one that has had to stop working, you'll be able to keep COBRA for up to 18 months, generally speaking. But if instead, the reason that you're no longer eligible for the policy is maybe you've aged out of your parents' policy, then you'd be able to keep COBRA for up to 36 months. Now, I mentioned that COBRA only applies to employers with 20 or more employees. So what happens if you work for a smaller employer? Then we're going to want to look to see if there is a state COBRA law in your state. The details definitely vary state to state, but I've given you sort of a layout here of what's available in each state. And even if you are eligible for the federal law, sometimes it's beneficial to look at the state law as well. Because for example, in California, you get 36 months no matter what. And so you get a longer amount of time than you would under the federal law. And we have this chart and many, many more details on our charts of state laws, and the link is here for you. Now, I mentioned that one of the benefits of COBRA is that it's the exact same policy. The downside is it's so expensive. So a lot of times people won't even consider COBRA because of the cost, but it is often worth considering still because you may be in a situation where you have already met your deductible, or maybe even your out-of-pocket maximum for the year. And if that's the situation, then it might actually be cheaper for you to keep the employer policy and know that all you're going to pay for the rest of the year are those monthly premiums, instead of picking up a new plan and having everything start over at day one. So this is just to kind of keep it in mind that even though, yes, those monthly premiums are very expensive, it's still a good thing to at least consider and do the math. The other reason I wanted to bring it up today specifically is in the American Rescue Plan Act, which was Congress's latest COVID relief bill. There is a provision that provides a COBRA subsidy that will pay 100% of somebody's COBRA premiums in certain situations. And so it's not going to apply to everybody, but if you either become eligible for COBRA before September 30th, or you would have been eligible and declined it, you might still be eligible for this benefit. And so we have an entire blog post that lays out all of the details here, but this is something that a lot of people don't know about right now, and it's still a benefit through September 30th. If you would be eligible for this subsidy and you've been paying since April 1st, you can actually get paid back for what you've paid. So switching gears slightly, I mentioned that the second largest group of individuals get their insurance through the government, and one of those programs is Medicare. Now, Medicare is traditionally thought of as only a health insurance option for older individuals, but it's also an option for individuals who have been receiving SSDI, or Social Security Disability Insurance, for 2 or more years. So you can be under 65, but if you have a disability that's keeping you from working, you might end up eligible for Medicare. Many people don't realize that there are options that need to be looked at in Medicare. And so this is going to be the 50,000-foot view of Medicare, and then I'm going to point you to some places where you can get some more information if you have questions. So when we're talking about Medicare options, there are two lanes to drive it. The first lane is referred to original Medicare, where you pick up Part A for your hospital insurance. So generally speaking, it's going to be inpatient type care. You're going to pick up Part B, which is your medical insurance. And so that's like doctor's visits and immunizations and some IV chemotherapies. Then you're going to decide if you need a prescription drug plan and pick up Part D. And these plans are sold by private insurance companies. And then there's an additional insurance policy that you can purchase to help protect you against the out-of-pocket costs associated with Part A and Part B. Now that's a lot, and it's a lot to consider, and it's essentially 3 different insurance policies with different costs associated. And so an alternative was created in Part C, otherwise known as Medicare Advantage plans. And these are plans sold by private insurance companies that bundle all of your Part A and Part B services into one plan, and many of them also include prescription drug coverage. So I lay this out just to mention that if you're at a place where you're not entirely sure which lane you want to be driving in, we have a plethora of resources, including a recorded webinar that is 90 minutes just on Medicare. We have what we refer to as our quick guides, which are 1 to 2 page documents that are downloadable that sort of walk you through the high level points about all of this. So certainly no shortage of places to get information on Medicare. For individuals who are in the position where COBRA isn't a great option, or they don't have access to Medicare or Medicaid, they may be thinking about buying their own insurance. And one of the places that they can do that is through the state health insurance marketplaces. Now, these marketplaces were created in the Patient Protection and Affordable Care Act, otherwise known as the ACA or Obamacare. Many, many people think that the plans sold in the marketplaces are government insurance, but they're not. They actually are at the top of our triangle of coverage. These are plans sold by private insurance companies. It's just that they're being sold through a marketplace. So think of it like this. It is Amazon for health insurance. So when you go to the marketplaces, you're still buying a policy from whatever brand or store you want to buy it from. You're just using Amazon as the delivery method, so to speak. So why would somebody even consider going to the marketplaces when you could just go to the insurance company? Well, the reason is that there are some added benefits to shopping through the marketplace. So the first is that there's a cap on the out-of-pocket maximums. Many of them are lower than this, but they can't be more than $8,550 for an individual or $17,100 for a family. Now, again, I know those are huge numbers, but when we start to think about it compared to what it would cost without the out-of-pocket maximum, it can feel a little bit more reasonable. There may also be financial assistance to purchase in the marketplaces. And this is going to be based on household size and income level. And so when we are talking about somebody who is potentially aging out of their parents' policy, this might be an option. The other time that we see this being a really important option is if parents have insurance through an employer that isn't covering the providers that they want their children to see or the prescription drugs, then it might actually be worth it for the child to actually get their own policy on the marketplace that meets their needs. And prior to the Affordable Care Act, we as Americans were sort of stuck in this mindset of, if we get insurance through our employer, we better hold on to it for dear life. But post ACA, that's not quite the case. And we have a little bit more flexibility. Just have to make our options so that we can make the best choices for our family. So I want to bring up that if you're thinking about, what options might be out there, you don't actually have to start by filling out a whole application. If you go to healthcare.gov-c plans, you can actually shop the marketplace without putting in personally identifiable information. It will ask you for zip code, age, household size, and income, but that's really to try to give you cost estimates. But no one would know it was you unless you actually log in and create an account. And what can be helpful about this is you can do some shopping around before you've committed to having your information out there. Now, there are certain times of the year when we can either enroll in new coverage or make changes. So if you are in a position where you are right now, where you don't feel like your insurance company is covering as much as you would want it to, you probably have the opportunity come this fall to make changes for the year ahead. And so when that's going to happen is going to depend on the type of coverage that you have. For the marketplaces, for example, the open enrollment period is going to be this fall. There's question marks because the Biden administration hasn't yet given us specific dates. But I bring this up today because, again, due to the pandemic, healthcare.gov has been reopened for certain individuals. So again, if you're in a situation where you don't feel like your insurance is meeting your needs, you might have the opportunity to pick up a new plan right now through August 15th. If you already have a marketplace plan, it is worth your while to go in and update your account because some additional financial assistance has also been added due to the pandemic. Now, you can benefit from these provisions even if you haven't been impacted by COVID. COVID was just the impetus for creating these things. And so again, these are things that not a lot of people really know about right now. So one of the things that the ACA did was it said that health insurance companies can no longer deny selling somebody a policy or deny covering care related to pre-existing conditions. And I got to tell you, I've been doing this a long time, and I never thought this day would come. I never thought we'd be in a situation where pre-existing conditions didn't matter for health insurance, but here we are. So that's another benefit to shopping through the marketplaces, because if you just go to an insurance broker, they might find you a policy that isn't creditable coverage. They're often referred to as short-term policies or junk insurance. And those policies can consider pre-existing conditions, both with respect to how much they're going to charge you and what they're going to cover. And so cancer is technically a pre-existing condition, but it no longer will impact somebody's ability to get health insurance, particularly through the marketplaces. So I hope that addressed the two questions in the chat box. If not, feel free to type some more. So I've laid out some options, and I realize that these options aren't going to be relevant for everybody at this exact moment. But one of the reasons that we do this when we talk is that it's important to understand that if your circumstances change, you may have other options. So how does somebody go about comparing their options and trying to figure out what is the best option for them? So I'm going to give you an example using the marketplaces, but the exact same analysis works whether you're comparing to marketplace plans, whether you're comparing to employer plans, whether you're trying to compare an employer plan with a marketplace plan, or even if you're trying to compare two Medicare plans. The same analysis works. So here we have 3 different plans, 3 different costs, monthly, 3 different deductibles, 3 different out-of-pocket maximums. At first glance, that bronze plan at $173 seems much better because it's only $173, whereas the platinum plan is almost twice that, it's over twice that. So how do we decide, assuming we're going to hit the out-of-pocket maximum, which when we're talking about cancer care is a pretty good assumption, how do we figure out which is actually going to cost us the least at the end of the year? There's no way to do it by just looking at it. We actually have to do the math. And here's how you do the math. You take the monthly premium and you multiply it by 12, because that's how much you're going to pay in premiums for the year. Then you add the out-of-pocket maximum. And when you do that for all three plans, you can see that that expensive platinum plan ends up being over $2,000 cheaper at the end of the year. So it's really, really critical to do this piece of it, but it's not the only piece, because we do this all over the country and it comes out differently every time. Sometimes the bronze plan does end up being the cheapest, but here's the other piece to look at. That bronze plan has a $6,000 deductible, which means that someone has to pay $6,000 out of pocket before the insurance company even starts picking up 60%. Whereas with that platinum plan, it starts picking up 90% right away. So while it's more expensive monthly, what it does essentially is it spreads the cost out over the year, and we don't have to come up with a big lump sum. So again, really important to make sure that you're looking at the total costs. Now, with Medicaid is a program that traditionally looked at somebody's income and assets, and if they met one other eligibility criteria. Typically, when we were talking about cancer, it was through what's referred to as the Age, Blind, and Disabled program. Now, the tricky piece with that is that the asset level was very, very low. It's only $2,000, and it was the highest standard of disability. And so it really created a problem for individuals who just had a low income, or who maybe had a low income and a disability but didn't meet that high standard. So the ACA created a fifth door to walk through that is just based on income. Now, if we are talking about a young adult who is accessing the program not based just on income, but also based on a disability, they may have more options. And this is why. When the ACA expanded Medicaid, the law intended that it was going to happen in all 50 states. But the Supreme Court got their hands on the law and sort of muddied the waters. And now what we have is a mishmash. So we have, I think, 39 states who have expanded, and the rest have not. And so the answer to the question about accessing Medicaid is really going to depend on your state. So we do have a chart on our website that shows you which states have expanded and which states haven't. And why I'm telling you all of this, even though you might be accessing it through the Age, Blind, and Disabled program, is that if at some point it gets to a place where you're able to go back to work and you're not considered to have a disability under the Social Security Administration, but you're not making enough money to pay for, let's say, a marketplace plan, you can actually shift from one Medicaid program to the other, assuming you live in a state that's expanded Medicaid. So it's really challenging to answer general questions because so much of it is going to depend on specific situations. And so I'm looking forward to your questions at the end. So I mentioned when you're trying to make decisions around picking plans, you have to look at the costs, but that's only a piece of it. You also have to make sure that any providers, so doctors, hospitals, labs, facilities, that you're utilizing are within that plan's network. Otherwise, you can have an affordable plan that doesn't cover anything, doesn't meet your needs. And the same is true for prescription drug coverage. Some plans will also have a separate drug deductible. So again, that's more money that you'd have to pay out of pocket. And so looking at those pieces is incredibly important. Now, there are some policies that require something called step therapy. Now, there are also lots of policies that will just deny treatments. And especially as new treatments come to market, in the early period of that, you may be denied because something is experimental or investigational. And so all of this is to say, at some point along the continuum of care, you're going to be faced with a denial. And this is regardless of where you get your insurance, to be honest. The good news is that as consumers, we don't have to take no for an answer. We have the right to appeal denials. Now, if you have a marketplace plan or an employer plan, there are generally 2 levels of appeal. There's an internal appeal where you go back to the insurance company, and then there's an external appeal. Now, one of the things about appeals is that it is absolutely an added burden on the patient and the patient's family to do this appeal. The good news is that somewhere between 40 and 60% of appeals are all decided in favor of the patient. So like generally 50% of the time when the insurance company says, no, we're not going to cover that, they're getting it wrong and they end up covering it in the long run. The problem with this is, even though the appeals process is incredibly successful for a majority of people, it's underutilized. Less than 0.2% of all denied claims are appealed. And so when we're talking about financial toxicity and we're talking about making sure that people aren't paying more out of pocket than they need to, this appeals process is incredibly important. And it's where I mentioned that getting the right insurance is only half the battle. It's also about using it effectively. So in order to help you all in the event that you have to appeal a denial, we have multiple resources. So if you have employer sponsored or individual insurance, we have a quick guide. We have a 90-minute webinar that goes through all the different kinds of insurance and appeals, so including Medicaid and Medicare and military. We also have an animated video and an appeals tracking form. So all of that's available for free on the website. Now, as I mentioned, there may be a point at which you have to stop working due to your treatment and diagnosis, or your family, your parents or your spouse might have to take time off. When we look for our employment rights, there are a couple of places we want to look. There are both federal and state fair employment laws that are going to provide protection against discrimination. But then for the individuals who are diagnosed, they may also provide a tool called a reasonable accommodation, which I'll get back to in just a minute. There's also federal and state leave laws that can provide either short or potentially long-term time off. And then if you are working under an employment contract or you're a member of a union, that contract or that collective bargaining agreement might provide you with additional or different rights and benefits. So important to look for that as well. But it is critical to remember that the laws are just the bare minimum of what employers are required to provide. And the reality is that employers are much more generous than that bare minimum. So making sure that you're looking at your specific employer's policies to see what benefits and processes have already been established. And to find those, you could look to some sort of policy and procedures manual or employee handbook. Over the years, these have become more and more sort of an online portal, but some employers still have kind of a handbook. If you don't have access to that, or your employer is maybe smaller and doesn't have sort of a formal handbook, certainly asking whomever at your job deals with employee benefits, like who do you turn your timesheet into, could be really useful. Now, I mentioned that the fair employment laws, like the Americans with Disabilities Act, provide protection against discrimination, but it also provides a tool called a reasonable accommodation. And reasonable accommodations are available to individuals who have been diagnosed and have a disability under the ADA's definition. And I've given you the big, long definition here, but the easiest way to talk about reasonable accommodations is through some examples. And I'm going to walk you through the examples because I know that they are incredibly useful and, again, underutilized. So there's 3 main categories. The first is about adjusting work space, physical space. So that could be about having or closer to, also be about telecommuting, which could mean working from home or maybe a different location. So if you are getting treatment somewhere very far from your office, is there somewhere where you can work closer to where you're receiving treatment? So first bucket is about space. Second bucket's about schedule. So maybe it's about shifting hours. So instead of working 5 8-hour days, you're going to work 4 10-hour days so that you have a day off, or additional breaks, or changing your schedule entirely. It can also sometimes be very helpful for leave. The last bucket's everything else. So maybe it's about technology, maybe it's about changing a policy. It could be about shifting responsibilities. Sometimes it's about changing jobs entirely. Now, of course, this is sort of the quick version, but I will tell you that what I get back from a lot of patients is, I hate to ask my employer for one more thing. But the reality is, if you are an eligible individual under the ADA, employers are required to provide you with accommodations, unless they're considered an undue hardship or a direct threat. But they do have to be reasonable. So, for example, if you are a barista, it's probably going to be hard for you to telecommute. But there could be a whole host of other types of accommodations that could, in fact, be useful. And when we're talking about accommodations, caregivers aren't legally entitled to accommodations under the ADA. But what we find in real life is that many times employers want to keep valued employees. And so they're willing to provide accommodation-like circumstances, even though the caregiver isn't entitled to it legally. So this is sort of that, like, it can't hurt to ask. As I mentioned, accommodations are one of the most useful tools under working through treatment, but also to take time off. And so we have a plethora of resources to help you. Now, there's a question about if cancer is considered a disability under the ADA. And the answer is, it depends. So the definition of a disability under the ADA is having a physical or mental impairment that substantially limits one or more major life activities. And I realize that is a mouthful. So breaking it down, you have a physical or mental condition that is impacting a major life activity. So what's a major life activity? Well, it's anything that an average person in the general population can do with little or no difficulty. Walking, talking, breathing, sleeping, the operation of major bodily functions, all of those are major life activities. Now, interestingly enough, when we talk about cancer, many times it is the side effects of treatment that give rise to the disability and not necessarily the cancer itself. And so that's also something to take into consideration. So while many people who are diagnosed with cancer do qualify as having a disability under the ADA, I can't state it blanketly without knowing more information. So reasonable accommodations are incredibly important if you are trying to work through treatment, return to work after treatment, or to take time off, depending on your situation. Now, the ADA applies to employers with 15 or more employees. So again, what happens if you work for a smaller employer? Well, we would look then to the state fair employment law. So this chart shows you the number of employees that are required for each state fair employment law. And if you don't see your state here, it means that it's the same as the federal, and the state law requires 15 employees as well. Now, if somebody needs to take time off, they might be looking to the Family and Medical Leave Act, or the FMLA. The FMLA is a federal law for employees with their own serious medical condition, or for employees who are taking time off to care for a seriously ill child, parent, or spouse. And this is a very narrow definition of family, but we bring it up because people don't realize that it is this limited. And so where we see some people get into challenges is if they're, for example, not married to their partner, and their partner is trying to take care of their child and get FMLA leave for that. That might be a situation where FMLA isn't available. Now, just like everything else I talked about, there's some eligibility. So in order to be eligible for the FMLA, you have to work for a large enough employer, and you have to have worked for the employer long enough. FMLA gives you 12 weeks of leave per year. And it is actually pretty flexible because you can take all 12 weeks at once, or you can take it off in segments, either to help you take time off or to help as a caregiver, or to help you take time off for your own treatment. You also can use the FMLA in small segments or intermittently. So if you are primarily working, but need a day off for when you're not feeling well or follow-up appointments, or as a caregiver, you need to take someone to an appointment, FMLA leave can be used intermittently that way. The major benefit about FMLA is that it is job protected leave, which means if you are taking FMLA designated leave, you cannot be demoted or let go while on that leave. It's also health insurance protected. So if you are out for 12 weeks and your employer pays a portion of your insurance, they have to keep doing that while you're out on leave. Many people think, oh, I've got sick time through work, so I'm good, but don't realize that sick time, vacation time, long-term disability, none of those things protect your job. What that's doing is providing you pay. And so to be the most protected, you're going to want to make sure, if eligible for FMLA leave, that you're using those benefits together so that you're both having the job protected leave, but then also you're able to maintain that income. Now, if you're not able to qualify for the FMLA, you might look to your state leave laws. These are across the board different, excuse me. And so for more details about what's available in your state, please take a look at that chart of state laws. They are categorized by topic. So this information would be on the employment page. Now, if you do have to take time off, what do you do about replacing income? This is where disability insurance can be very helpful. And what disability insurance is generally is it's an insurance policy that will replace a percentage of your monthly income that you were getting when you were working. And disability insurance can pay for any of your expenses. They don't have to be medical related. There are several places we might be able to access disability insurance. So private insurance, can be both short or long-term. So short-term is usually up to 6 months, long-term is usually a year or longer. Many employers will provide disability insurance as a benefit of employment, or sometimes you purchase it directly from the company itself. One of the challenges with private insurance, disability insurance, is that there aren't the same protections for individuals with pre-existing conditions in disability insurance that there are in health insurance. So once somebody's gotten a diagnosis, it can be harder to purchase your own disability insurance policy, but not necessarily impossible, particularly if you have not been in active treatment for a while. You might be able to access a policy. Another source of disability insurance might be through a state disability insurance program. You can see that there are only a handful of states that do this. The details definitely vary state to state, but typically these programs are paid into by payroll taxes. And so even someone who is younger but has a job and has been paying into payroll taxes might have access to this. These are short-term programs, so they typically won't be for longer-term disabilities. And then the final two programs are through the federal government, and these are through the Social Security Administration. Two different programs: Social Security Disability Insurance, or SSDI, and supplemental security income, or SSI. Now, both of these programs have the strictest standard of disability, and that is you cannot do your job, you cannot adjust to a new job, and your disability has or is expected to last for a year or longer. Now, what's really interesting about this is that these are federal programs, but the entity that makes the determination if you have a disability or not is at the state. And so there we see sort of wide variations across the country, and no two offices are exactly the same. So the major differences between these programs: SSI is for individuals who have low incomes and low asset levels. Typically, benefits start right away, and there is a monthly max this year of $794. Typically, individuals who are eligible for SSI are also eligible for Medicaid. So SSI provides sort of living expense dollars, and Medicaid is going to provide the health insurance coverage. Whereas SSDI is about having work history. So it's about having worked and paid into the system. So the amount of work you need does depend on your age when you become disabled. And the amount that you're going to get monthly is going to be based on how much you've paid in. So Bill Gates would get more money than I would on SSDI because he's made more monthly, presumably. With SSDI, there is a waiting period before you can start to collect benefits. Now, there is some opportunity to, because this is not a fast process with SSDI, it can take a very long time. There is an opportunity to get back pay. So if anybody's in a situation where they're eligible for SSDI and they're not sure if they should be getting back pay or whatnot, feel free to reach out. Now, once somebody's been on SSDI for 2 years, they would be eligible then for Medicare, which is why I brought it up, even though I know many of you are under the age of 65. I mentioned that the process for applying for disability through the Social Security Administration takes a long time. One of the ways that that can be sped up is through the Compassionate Allowances Program. And this is a list of medical conditions that are presumptively eligible. And it doesn't get you through the 5-month waiting period any faster, but it does certainly speed up the process for the application. And the diagnosis that we're talking about today does appear on the Compassionate Allowances list. So this is a screenshot from the Compassionate Allowances website. You can go in, you can put this list in. And what's really useful about this is if you use your specific diagnosis and you use one of the names that you are looking at on this screen, the computer software actually picks that up and can process the application faster. It gets it into the hands of humans faster. So it is absolutely, if you are considering applying for SSI or SSDI, to make sure that you're using the specific terms. Now, even though it's on the Compassionate Allowances list, you might still be faced with a denial. It happens, unfortunately, too frequently. The good news is that there is an appeals process through the Social Security Administration as well, because about 65% of all applications are denied outright. And so if you are in that situation, it is critical to work with your healthcare team to submit an appeal. The first level of appeal in most states is basically just a letter that gets sent back with more medical documentation and more evidence. And then if you still get denied, which I doubt it would happen in this situation, there are additional levels. If you get to the level of an administrative law judge hearing, it might be beneficial to consider hiring an attorney. And the way security appeals attorneys work is that they only get paid if you win, and they get paid 25% of your back pay. So many people think, wait a minute, I'm not working, I'm so sick, how am I going to pay an attorney? And so I bring that up because costs shouldn't be a barrier to you hiring an attorney. And we also have a quick guide specifically on finding legal assistance that provides you with some tips. We also have a plethora of disability insurance resources. So depending on where you're looking for disability insurance, we have some tools for you there as well. So the last couple of minutes, I just want to talk a little bit about the resources that we have at Triage Cancer, so that after tonight, you'll know where you can go for more information. We have a website called cancerfinances.org. And on this website, we have modules on many of the topics that can impact your finances after a cancer diagnosis. And so what is unique about this site is that it asks the user questions, and then you don't have to put in anything. So like a healthcare provider could do this for a patient, a parent could do this for a child, a spouse, et cetera, et cetera. The website will ask the user questions, and then based on the answers to the questions, take you to targeted information. So for example, if you're in health insurance and you answer you're under 65 and you're not receiving SSDI, we're not going to give you information about Medicare because that's not relevant to you. So this is our most comprehensive tool because we have narrowed down the information by virtue of the questions. Really, I've just scratched the surface tonight of cancer-related legal issues. And so these are some other very common topics that we get asked about frequently, and all topics that we have resources on. I also want to mention that if you want to learn more about all of these topics and more, Triage Cancer hosts free conferences every single year. This year, it's going to be virtual. It's totally free to attend. We also provide free CEs for healthcare professionals and HR professionals. All you have to do is register. And you are welcome if you yourself have been diagnosed, if you're a caregiver, you just want to learn more, because in reality, this information is actually quite useful to most of us that have to navigate health insurance. We welcome you all. All you have to do is go to our website and register. We also, as I mentioned, have a ton of free resources, particularly our quick guides and checklists and our animated videos. Our state resources become very, very important, particularly if you're not eligible for some of the federal programs. If you're looking for a one resource to look at, we've recently, my goodness, it's a long day, I apologize. We've recently released a comprehensive guide called Cancer Rights, Navigating Employment, Insurance, and Finances. You can order hard copies on our website or just download it for free. And because we know that even with all of these resources, you might still have questions and they might be really specific to your situation. And so we host a free legal and financial navigation program where you yourself can call, your caregivers can call, your healthcare professionals. And when I say call, I really mean go to our website, fill out an intake form, and then schedule a 30-minute meeting with a cancer rights attorney to get some more information and get your questions answered. So all of that is to say that I hope tonight is not your last interaction with Triage Cancer, and that you will benefit from our resources. So with that, I'm going to turn it over to Sandra and stop sharing.
Hi there. I also want to encourage everybody to go to the Fibromedullary Cancer Foundation website. We have a very exclusive resources section that goes beyond what Monica just offered tonight. But I do want to open this up for questions. And Monica, I'm going to ask you a couple of my own. Young patients, teenagers dealing with cancer and their parents. they're dealing with many life situations like education. They're going to college. They might just have gotten their first job. Parents are serving as caregivers. Can you talk a little bit about that? Because it seems like all of this is so weighted in favor of an adult patient. What happens to the teenage patient, and what do parents do when they're faced with this type of diagnosis?
So almost everything that I've talked about is going to be relevant. It's, of course, the details are going to vary situation to situation. Certainly, the concept of reasonable accommodations exists in both the education and the housing arenas. So if somebody is struggling in school, they should absolutely understand and avail themselves of reasonable accommodations at school. And that's in both K through 12, college, and grad school. So a lot of those exist, again, in those two arenas as well. With respect to the health insurance piece, that really goes back to understanding the various options and then understanding how to make those choices. So if both parents are, working and have great health insurance through their employer, what does somebody do as they age out of their parents' policy? What's going to be the choice then? And so that's why it's important to understand the marketplaces or potentially COBRA, because there might be some treatments that the plans in the marketplaces aren't going to cover. So that speaks to the point of, it might not be relevant right now because maybe, your child is covered under your policy at work, but what happens as they age out of that policy? So.
And the second question I know that has come up is, given all the deductibles and the max amounts, sometimes a cancer diagnosis could go into the hundreds of thousands of dollars. What happens if there is financial hardship, and what recourses do patients and their families have?
Well, so here's the thing. If someone has picked an appropriate health insurance policy for them, then it shouldn't go into the hundreds of thousands for them. Right. Certainly the actual cost could be that high, but that's why understanding that out-of-pocket maximum and understanding networks of providers and prescription drug coverage is so valuable because, well, as I mentioned, yes, $17,000 for a family out-of-pocket maximum is a lot of money. It is certainly better than those hundreds of thousands of dollars. Now, with respect to what do you do about even paying those out-of-pocket costs, that goes back to, there's different strategies here. So it could be about, is the patient eligible for Medicaid? In that case, maybe that might be the better option instead of being on a parent's plan, even if they're able to still be on a parent's plan until they're 26, because the out-of-pocket costs with Medicaid are going to be lower. It goes to speaking to, there's strategies about accessing the help of the pharmaceutical companies. And what I often find is people get a little bit of tunnel vision, right? So they'll say to me, we can't cover all these deductibles, or we can't cover all these copayments. And so what I'll say is, well, maybe what we can do is get you pharmaceutical assistance for the cost of the drugs, and you can shift the money that you were paying out of pocket to other expenses. And so sometimes I call that financial Jenga. And it is a lot of work. And it again is really unfortunately placed on the patients and families to navigate all of this. And it is almost a full-time job to do so. But that really speaks to an advocacy discussion about how do we improve our system.